Did you hear about this Henry Ford vaccine study? A lot of people have been asking me to address this issue, and it's another example of how RFK Jr. is trying to sow distrust in vaccines. Essentially, one of his personal lawyers, Aaron Siri, was an expert witness at a congressional hearing a couple of days ago discussing unpublished results from the study that came out of doctors from Henry Ford Medical System, where they did a retrospective chart review of about 5 to 6 years worth, and they compared two groups of individuals. They had children who were vaccinated and children who were unvaccinated. 18,500 kids who were vaccinated versus 2,000 kids who were not vaccinated to see what kinds of chronic health conditions they ended up having. And they made some claims that the children who were vaccinated were significantly more likely to develop various chronic diseases such as tics, ADHD, and allergic diseases. And they had said that those who were not vaccinated, there were several conditions like ADHD where none of those kids were diagnosed with it. Now, RFK Jr.'s lawyer had claimed that the reason why this was not published was because the study authors were worried that they would get fired over the potential findings, and that's an unsubstantiated claim. The reality is that there's a good chance that the study wouldn't have been published because the methodology is significantly flawed. Number one is that when you have a retrospective chart review, if you've got two groups of individuals where there's a lot in one group versus a small number in another, it's not going to be well balanced. The smaller group of individuals who are unvaccinated, we know from previous studies, those children are less likely to seek medical care for different issues, so they're not going to have as many office visits and not have as many opportunities to have a diagnosis. They're going to seek alternative routes of care more likely compared to children who are vaccinated. In addition, statistically speaking, it's pretty much impossible to have 2,000 kids with 0 cases of ADHD, regardless of what group that you're looking at as a subgroup analysis, because the national prevalence of ADHD is somewhere around 10 to 11%. So there's something unusual about that in terms of the data set being analyzed. On the other hand, there was a recent study published with a Danish cohort of about 1 million children that included close to 20,000 children who are not vaccinated that found the opposite, that children who are vaccinated were less likely to develop chronic diseases. So if you hear about this study or you need to talk to a family member where they have concerns about it, feel free to save this video and share it with them so they can understand what the potential pitfalls are of this unpublished research.